Hello class, welcome to day 3A, which is chapter 11. Chapter 11 is talking about positioning, moving, and lifting a resident. Different positions that residents can be put in for comfort, and we're going to talk about that in this chapter. And again, continuing from the safety that we talked about in the previous lesson, which was day 2B. So this is kind of in line with that. So definitions: posture. That's the way a person holds positions their body. So explaining alignment and principles of body mechanics. So we talked about that before. Proper body alignment helps the body to function very well, helps the body with balance, um, without straining the muscle and the joints. The lungs are able to expand and contract better. Circulation is more efficient. Digestion is easier. The kidneys function better. Again, it helps prevent complications of immobility. So remember the principles of proper body mechanics learned in chapter 7. Rules about proper body mechanics: assess your load, think ahead, check the base of support, face the object that you're lifting, keep your back straight. Begin in a squatting position, tighten your stomach muscles, keep object close to the body, push rather than lift. So positioning, different ways to position the resident in bed. Positioning just means the act of helping people into positions that promote comfort. There is supine position. This is where someone is lying flat on their back. Lateral position, in which a person is lying on either their left side or their right side. Prone position, that's lying on their stomach. Fowler's position is like a semi-sitting position on the bed, whereby the head of the bed is raised about 45 to 60 degrees. Sims position, this is a left-sided position with the knees flexed and raised towards the chest. Now don't get this confused with lateral position. Lateral just means left side or right side, but there's a specific left-sided position that is called Sims. And later on you'll learn that this is the position to give enema, and we'll talk more about that in another chapter. Shearing is when there's rubbing or friction from the skin moving one way and the bone underneath moving a different way or remaining fixed. Log rolling is when you move somebody as a unit so that to maintain the alignment. This is especially important for people that just had hip replacement surgery. When you're turning them, you want to turn the whole body at once in the same motion to avoid dislocation. Dangle is when you sit on the side of the bed without your legs touching the floor. This is important because when you're getting somebody up, you sit them on the edge of the bed with their legs not touching the floor until you put their sandals on or shoes on, before you can now have them come down to be more balanced on the floor. So these are pictures of the positions we just talked about, the 5 basic positions. You can see supine, lateral, prone, Fowler's, and Sims. So we talked about those 5 positions already, and this position is not used in the nursing home, mostly in the surgery, in the hospital. It's Trendelenburg and reverse Trendelenburg. Just for your information, you will see throughout your textbook how to do this and how to do that, all the steps assisting to move a resident up in bed. We're going to talk about some of those, but always refer to your handbook that we gave you with the homework book and your textbook. That's the CNA handbook from the state, because Maryland, those are the steps for each skill. that will be tested. So they're slightly different from the textbook. So we always go with the textbook. So you will see me kind of go past skills in the slide. That's because we, you know, go with what's in the handbook. So here, assisting to move somebody up in bed. This will be not a good way for him to do it. He's trying to lift this woman as if the woman is a baby. What needs to happen is to get help and have two people move, one on the other side, and then it'll make it easier. So let's look at that. So this assisting somebody move up in bed with assistance. You can see that there are two people there, and there's a draw sheet the resident is lying on. Make sure the pillow is placed over the headboard. You don't want the resident's head to hit the headboard. I've seen that happen before. And then you count to 3 and give each other a signal so that you can now move. Let's look at the next slide. You can see now the movement is completed. She's now up in bed. This is where she was before. Now she's way up in the bed. So we're gonna. Next one is to moving a resident to the side of the bed. You can just bring the upper body close towards you, then get the lower body close towards you, just like she did there. Okay, and then turning a resident towards you. Same thing. Have them go to the other side and then just turn them towards you. This is log rolling that we talked about earlier. It's important that you have, you can see that there's a pillow placed between the legs to maintain the alignment. And so that as they turn the person to the side, nothing is going to move. If they just had hip replacement, it's still going to stay in place. So see that they've completed that log rolling of the residents to the side. This is assisting a resident to sit on the side of the bed, and dangling the legs like we talked about earlier just means that their legs don't touch the floor. You dangle the legs first before you put shoes on them. Okay. This is again turning a resident away from you. Again, you get the picture. Ergonomics just means a science of how equipments are designed. Transfer belt is a belt that is meant to be used to help transfer or to walk a resident. Again, some of this equipment, we have them in the skills room, and so write it down so that you can ask your instructor to show you what a gait belt looks like. But at some point you will get to practice transferring a resident from the bed to the wheelchair using a gait belt, or walking the resident using a gait belt. So don't worry, you will get to see all this equipment. I mean, most of them, not all of them. So a gait belt is also called a transfer belt. Mechanical lift. This is like a hydraulic machine that helps to lift people that weigh over 300 pounds that it's not a good idea to lift them manually, two people, lifting them. So well, let's just go to the picture of the. Okay, before that, let's talk about applying a transfer belt. It's just like a belt. You put it on. Make sure you use the smooth side on the resident. We'll talk about the mechanical lift later. This is guidelines for wheelchairs and jerry chair. Remember to lock the chair before you transfer the resident. You don't want to forget to lock the chair and then you have the resident being transferred from the bed to the wheelchair, and as you're trying to lower the resident into the wheelchair moves backward because it wasn't locked. What's going to happen? Resident is going to hit the floor. Maybe you're going to hit the floor as well. So make sure you lock the wheelchair. Okay, so by the way, if you're not familiar with a jerry chair, so a jerry chair is like a big recliner, very comfortable. Some of them take naps in there, but it has wheels. It has like a table attached to it where you can put a table on it and have the resident eat their meal on the table there. You can remove the table when they finish eating, otherwise it will be considered a restraint, because when the table is on, they're not going to be able to get out of that chair. So if they're not able to get out of the chair, that will be considered a restraint. So now let's talk about mechanical lift here. Again, it's better to use the picture. This is a mechanical lift there. In my facility, it is a policy that 2 people must use the lift. So the way the lift works, you bring it, there's a lift pad that has to be placed under the resident. You can see the lift pad there. It comes with hooks that will then hook onto the top of the mechanical lift. It's also called Hoyer lift. Like I said, it requires 2 people, so let's go to the next slide. So the previous slide here, you can see the CNA is hooking up the lift pad onto the lift with the resident in it. Then one person will go back to control the lift. It has like a remote control. It will now lift the resident up. Well, the top of the mechanical lift swings around because it will allow you to swing the resident and position the resident properly in a chair. So there's a chair nearby where they're trying to transfer this resident from the bed to that wheelchair using the mechanical lift. So while one person goes to operate the lift, a second person here needs to control the resident's movement on the lift so that they can direct the resident once the resident is over the chair and will fit, properly. Then the person behind the lift will lower the resident onto the chair, and they will sit on the lift pad, because when they're ready to go back to bed, then they need the lift pad to be on so that they can hook the lift pad onto the lift to help transfer the resident back in bed. It's very important that 2 people use the mechanical lift. Here's CNA using a gate belt on the resident. I guess walking the resident to the bathroom. Okay. Wheelchair, transferring a resident from a wheelchair into the vehicle. The most important thing to know here, you're going to follow your processes, make sure the wheelchair is locked and all that. The most important thing to know when you're transferring a resident from the wheelchair to the car, make sure that you put a seatbelt on the resident and make sure the door is closed. If you just sit them in the car, door is open, you don't put a seatbelt on them, and you walk away, what's going to happen? They're going to fall out of that car, and it will be the fault of the CNA. Ambulation just means walking. Again, walking is, part of exercises that, helps promote body functioning, helps with quality of life, help with circulation, strength, sleep and relaxation, improves appetite, elimination, and oxygen level. So you have to know guidelines for how to walk somebody who is visually impaired. Visually impaired means that somebody could be partially blind or totally blind. Very important that when you're walking somebody who's visually impaired, resident walks beside and slightly behind the nursing assistant. That means you are in front. We've had situations where there were questions in a test that says, where should a nursing assistant stand when walking a resident? In front, to the side, or behind? Well, just think about this. should you, as the CNA who can see, lead the resident? Yes. Because the resident that is blind cannot lead you, so you're not standing behind the resident. You're standing in front of the resident, slightly in front. They hold your hand, and you're going to give them information. You're going to say, okay, we're going to take a few steps and turn right, and then turn left. Then we're going to go down the hallway. Just make sure you inform the resident of any direction or changes as you go along. That is the end of the chapter.